Well, it's that time of year again. You're going through the open enrollment process and looking at what changes need to be made to your 2019 plan. With everything you need to know about the open enrollment period, we have Raymond Hurd here with us. He's Regional Administrator for the Centers for Medicare and Medicaid Service. Raymond, thank you so much for joining us.
Oh, it's my pleasure. Thank you for having me.
Of course. I think one of the biggest questions is, when does this Medicare open enrollment end? I know we need to have an end date for a lot of things.
We do. So open enrollment runs from October 15th to December 7th every year. So the end date is December 7th.
And what do Medicare beneficiaries need to be doing during open enrollment?
Well, sure. So the first thing they should do is look at if they currently have a Medicare Advantage plan. Maybe something's changed. Maybe they're not covering their doctor anymore, or the prescription drugs that the plan is covering no longer meets their needs. So they need to assess their current health needs and what their plan currently offers. And then they need to decide what's best for them. And they can go to Medicare.gov and go to the Compare tool, and it will walk you through 5 simple questions what options may be best for you. And then you can compare those options and maybe find a way to save some money or get some benefits that traditional Medicare doesn't cover.
A lot of times this can be easy to put off. The process can be easy to put off. So why is open enrollment so important for people with Medicare?
Well, basically because traditional Medicare doesn't cover everything, and so our Medicare Advantage plans often cover other benefits that you won't find in traditional Medicare. So if you're looking for maybe some hearing or dental or even vision coverage, some Medicare Advantage plans might be best for you. It can also help you save out-of-pocket costs, so you need to compare costs between traditional Medicare and Medicare Advantage plans.
Another question is probably a huge question is, what happens if I miss that deadline?
Unfortunately, if you miss the deadline, you won't be able to have another opportunity to enroll in a Medicare Advantage or a prescription drug plan until the next open enrollment period, which is next year, starting October 15th.
Now, people, when it comes to this, they want to be educated. They want to be able to do their research. So where can people find more information online, especially?
Well, again, Medicare.gov is the best website, pretty robust, some good tools there. But if you want to talk to somebody, you can always call 1-800-MEDICARE and ask any questions you have about the Medicare program. If you're interested in local help or face-to-face help, every state has a state health insurance assistance program, and if you call 1-800-MEDICARE, they can get you in touch with those counselors where you may be able to sit down and do a face-to-face walkthrough of what your needs are.
All right, thanks so much, Raymond.
Thank you.
Thanks to the Centers for Medicare and Medicaid for sponsoring this segment.